Fam, I'm in here to see the orthopedic surgeon for my shoulder. I have hurt it. Don't know what I've done. I only lifted so far. Goes into my elbow, all the way into my fingertips. And it'll go numb, and it'll hurt so bad that I can't move it. It's stuck in my chest too here. It goes under. But he's did some x-rays, waiting for him to come in. But I guess we'll figure out once they get everything. They done x-rays. He's not came in yet. And these are my x-rays. I don't know if it means anything, if I've done anything. I don't know, but we'll see. Yes.
Hi, Jamie.
Hey,
nice to see you back. Pleasure to meet you today. I'm joined by, we'll just take a look at your pictures in the other room, but would love to hear about how I can help you with your shoulder.
I don't, it's just been, over time, it's been bothering me. When I was a kid, I broke my collarbone. I can't remember if it was this one or this one.
Do you know about how old you were when you broke it?
I was probably about 10, I'd say.
Yeah, this left one looks pretty normal.
Okay.
But it could be the left. You know, the nice thing is when you're that young, the bone will remodel and kind of smooth out the fracture over time.
All right.
So anytime you're under that kind of 10 to 12 range, they usually heal up pretty darn well. Okay. So it shouldn't have too much long-lasting change. Okay. But you might feel a little bump there. So if one side does feel a little different, it's probably that side.
Okay. Well, the pain here lately, over the past year now, at first we thought it may have been my heart because it's like a little pinpoint, it goes here.
Sure.
But the heart doctor, everything was fine.
That's good.
And it's just gotten worse over time to where I could just only live so far.
Yeah.
My elbow here, I can't go straight out with it anymore. And when the pain gets really bad, I'll get a swelling through here, kind of like the tennis elbow. And the pain will go straight down through my arm into my fingertips. It'll start going numb a little bit.
Okay.
And I mean, I can't even lay on my shoulder anymore.
And this pain and the feelings in your hand, are you having tingling and numbness in the hand?
Yes.
How often do you have that?
It's every day. It used to be able to go away. It maybe be a couple times a week.
Okay.
Like the more I do, the more it would start hurting.
Okay.
But now it's like it's always there.
And on a scale of 1 to 10, how bad is the shoulder pain? Or 0 to 10 if
It
zero
can get up to a 10.
Okay.
But I used to get down to a 0. But over the past, I'd say 3 to 4 months, it's got no lower, I'd say, than about a 5 or 6.
Okay, that's getting up there. Are you having any neck pain?
I do a little, but not that bad.
Okay. Any limited movement of your neck at all? Okay, good. Let's take a look. Can you show me how high you're reaching up with that left shoulder?
Right there's where the pain started.
Right about there.
Yeah.
And then let me have you bring it back down. And then with your thumb up, try to bring it going forward as high as you can go there.
Right in there.
Very limited, yeah. So let's say active is about 90. If I do the movements, does it tend to go up a little higher? Like, is that easier for you if I do it, or it just won't go? Okay. And have you noticed that the shoulder kind of feels a bit stiff?
Yes.
So I'll say passive is also 90, abduction's about 50. I'm sorry, we'll say 60. Sorry, I don't mean to beat you up here. We'll say ERA is 55, IRA is -10, and the ER is 30. Well, I see this is very, very limited for you. Is that, and it seems to be very inflamed too. So I really see this as a tough problem for you. Sorry, this is hurting so much. Okay, we're gonna get this figured out and get you feeling better. I like your watch face there.
No, thank you.
You're welcome. Any pain if we rotate here? Yeah, we'll say positive Hawkins. Lift up to the ceiling as best as you can. Any pain there?
Little.
Okay, we'll say mild speeds, raise up, mild O'Brien's, raise up here. Oh yeah, we'll say positive speeds. Bring the arm back here. Any tenderness if I push on the front of the shoulder here? What about here on the side?
Yes.
Up top, any pain?
No, right there.
Let me see if I don't have a soft tissue, but I do have a paper towel here.
Try not to be a baby.
No, you're fine. I can tell this is really inflamed, so. But we definitely have options on how to get you better here. Just gonna check your pulse here. Good. Let me have you gently bend up against my hand here. Push out toward me, out to this or inward, and bring your arm forward. and raise up here as best as you can. Big picture, your shoulder's got a lot going on. Number one problem is a frozen shoulder. It's very, very limited. It's hard to know exactly the cause. But what frozen shoulder is, it's where the capsule or lining of the shoulder thickens and can become very painful.
Okay.
So we need to try to help bring down that thickening, and the pain and the inflammation will go away. Okay. And one of the ways that we can do that would be with an injection. It sounds like you had one a few months ago. Can you tell me about that?
Yeah, they did an injection back here, and when I left there, I was almost ready to go to the hospital. Because all it did was make it worse. I mean, it hurt so bad.
Oh. Okay, what kind of shot it was?
It was an X-ray that he had, and then he put the injection with an X-ray.
Oh, okay.
So.
Yeah, probably with that little probe on the shoulder, ultrasound guided or something.
Yeah, it was just a lot of pressure. It's like he was almost taking something going like this to make a hole. That's what it kind of felt like. But
yeah.
So.
Oh, I'm sorry, that's a tough experience. What kind of medicines are you taking at home?
I'll take Tylenol. I try to take the ibuprofen. We did the 800 milligrams, but I've got an ulcer, so that kind of hurts my stomach.
Yeah, we should stay away from that.
Yeah, and it helps the pain. Sure. It don't completely take it away, but it's tolerable.
Okay. All right.
So.
We could do a steroid pack by mouth.
Okay.
And that could really decrease the inflammation without a shot. And it's also not an NSAID.
Okay.
So it should be a good bit easier on the belly. And then potentially we could pair that with a muscle relaxer to decrease some of the tension there.
Okay.
The only thing that we have to make sure that you're aware of is that you can't drive with the muscle relaxer. It's really just for at night when you're resting.
Okay.
So, but I think that might help you feel a lot better when you're getting ready to lay down or just relax for the night.
Okay.
So I'd say that maybe we start with those medicines. We can add in the physical therapy to help you recover as well.
Okay.
That might be a good first place to start. So if we can get this to calm down with the medicines and the therapy, that'd be a home run.
Okay.
One thing to know about frozen shoulder is that typically it takes 6 to 12 months to resolve.
Okay.
But it can be faster for some people, and for other people it can take longer. If it is something that's lingering longer than, I would say, 9 months, I usually try to think about ways to help solve the problem. So if we're really getting to that point, long term, then there are rare chances that we do have to consider surgery. Okay. So let me talk to the team. We'll send those other medicines to your pharmacy. We're going to get the physical therapy form printed for you. Then I want to see you back in around 8 weeks, and we'll recheck your progress.
Okay.
Awesome. It's a real pleasure to meet you. I'm sorry you're going through this, but we're going to get you better, okay?
Thank you.
Absolutely. Thank you.
Yes, I cried. That hurt. But everything they have to do to your shoulder and stuff hurts so